Yeah, no, this is my second time coming to BioXcellerator because I saw such great results the first time. It was almost 3 years ago I came, or 2.5. This time I did the same thing as I did before because I, beat up shoulders and knees. But last time I had a broken hand, and we did that, and my hand is completely 100% now. And still no side effects. And I did my left ankle that I had fractured, and again, that's back to 100%. Just the joints that I keep wearing and tearing on through my normal training, I did them again because they seem to keep getting beat up, even though there is huge improvements in the shoulder area. The knees, left knee was about, almost didn't even need it, but I didn't want to take a chance of not doing it. My right knee was the worst out of it, and really, honestly, the worst injury I have is my hip. I injured my hip about 2 months ago badly, and it was just inflamed and swollen. In fact, when they did the injections, I almost jumped off the table. It hurt pretty bad. Yeah, no, I felt such great results last time, and obviously I came back a second time. But even so, that my daughter, and even looking at my sons and stuff and bringing them, just I brought Bella because she has a very physical career. She's a national champ wrestler, multiple times state champion, and now she's 3-0 as a professional fighter, and looking to push a career in both those areas.
Well, at first I was like, oh, my injuries are good right now. I was like, I don't know if I want to come. But even just having them inject the stuff just a couple days ago, I feel like a major difference. I'm like, oh my God, my wrist doesn't hurt when I bend it. I can move my arm completely above my head. It's crazy, how fast it works.
I feel that if stem cells can work great enough that they worked on me on how bad down the line my joints are, I can only imagine if we get ahead of the curve on her and take care of injuries as they come up, then she'll have a very long and healthy and less miserable career than I've had.
I did my wrist, my shoulder, my ankle. I broke my fibula and tore some of the ligaments inside of it. I sprained my wrist in a car accident, and then I tore my labrum. It's really just when they're putting the stem cell inside, when they're pushing it, you can feel it go in, that's when it hurts. But as soon as they stop, it feels fine now.
I remember one time Ronan was sitting on my chest and we were looking at the iPad, and he moved in a certain way that just my shoulder popped out, and I screamed and almost threw him off the bed. I came here and had it injected, and I've had no issues with my shoulders. Every once in a while, it'll feel tight or ache at night if I've really had a hard, specific shoulder day, or if someone really attacks my shoulder in class. If I get caught in something. But other than that, I avoided surgery altogether. So, and I'm actually curious because I've had MRIs now done. I want to look at what they say, the before and after, because I'm a skeptic about things big time. And it worked on my shoulder. One final ride. One final ride. I'm 43. Obviously, I have more fights behind me than I'm ever going to have in front of me right now, and I just want to heal my body up to go out there and compete. One last time, to fight on the same card as my daughter, just to have a father-daughter moment like that, and maybe even my son at this point. We can all fight together one night before I call it a career and go full-time coaching.
Never met nicer people before. Just the way that they treat you, how they just want you to get better, and that they just really care for you. I just think that how they treat their patients is probably the #1 thing I look for.
BioXcellerator is a 10 out of 10, honestly. In fact, the doctors here are so phenomenal that anytime I even went back home and told my wife, any procedures or anything we need to get done, we're going to come to Colombia, even if it's not a BioXcellerator type situation they can fix. I'm going to call up Eric and be like, hey, what hospitals, what doctors you have working there, can we, just because the level of care and concern, and even just the prowess. I've been here with other people that have gone into doctors in the States, and they can't really figure out or pinpoint what exactly is the root of their problem. And a 15-minute conversation with the doctors down here, like, oh, your problem is here. It's happened to me. That's why I injected my ankle last time I was here. I've had ankle problems, and the doctor goes, no, your problem's, he pointed up my calf where my fibular bone was. He goes, no, there's a nerve here that you have impinged, and that's what's causing the problem. We'll inject that. Sure enough, he stuck a needle in there and it fixed it. And I've been to the point where I didn't even want to bring it up. I'm like, look, it's a dead horse. My ankles are screwed. And they fixed it. If it's within your capability to come down here before surgery, I say try this first, because anytime you cut something, it's never the same.